I talk to guys all the time on the phone who say, yeah, P shots, I do them all the time. I do them every night before I want to have sex. That's not the P shot. We'll explain.
Hi, I'm Stephanie Wolff, PA and CEO of the Novus Center.
And I'm David Dumbroski, the Center Director for the Novus Center.
And today we're going to discuss the difference between Trimix Injections and the PRP P shot. There are many men that come through my office that can't tell me the difference between these two injections. They can't tell me which one is the synthetic medication and which one comes straight from your own blood. So what exactly is Trimix? Trimix is a compounded drug that's made up of 3 synthetic chemicals: Alprostadil, Papaverine, and Phentolamine. Believe it or not, it is not a PDE5 inhibitor like your Cialis or Levitra or Viagra, but it does act very similar to those medications. Once you inject Trimix into the corpus cavernosa, it takes approximately 5 to 15 minutes for it to actually start working, meaning causing an erection. And then this medication will last for about 4 hours in your bloodstream, similar to the PDE5 inhibitors. Now, let's break down each of the 3 synthetic chemicals that are found in Trimix. The first one is called Alprostadil, and this is actually a prostaglandin E1 medication. It causes vasodilation of the smooth muscles of the penis, which allow for maximum blood flow into the penis, hence an erection. Papaverine is an opium alkaloid antispasmodic. Yes, that's a tongue twister, which also is a smooth muscle relaxer, again, allowing for maximum blood flow. And then you have Phentolamine. Phentolamine is actually an alpha-1 blocker, which is very similar to the class of medications that is used for an enlarged prostate, or better known as BPH. And one of those medications that is usually used for BPH is called Flomax. That's also an alpha-1 blocker. So these alpha-1 blockers are vasodilators, again, relaxing the smooth muscle of the corpus cavernosum, allowing for maximum blood flow into the penis. So you can see that with Trimix, when you have all 3 chemicals that are all causing this smooth muscle relaxation, maximum blood flow to the penis, that's going to give you an erection. We here at Novus have had many patients develop Peyronie's disease, which is either scar tissue or a bent penis or perhaps inflammation and pain upon erection after the chronic use of Trimix. So whether that's because of the injection itself creating the scar tissue, or perhaps it's the synthetic medication that's being injected into this tissue, can cause sporadic and unpredictable scar tissue, according to a study that I'm going to provide in the link below. Now, I, as a healthcare provider, have realized that men who solely rely on Trimix for their erections start to lose this brain-penis connection. They're so used to this automatic erection, that they become addicted to it. They figure, well, why have to think about it? Why do I have to put effort into it? If I can just do this injection, I'll get an erection within 5 minutes and, the rest is history. And I try to explain it to them like this. It's very similar to using Afrin or Ambien. Afrin, for those of you who don't know, is a nasal decongestant. So you can just buy it over the counter, but you have to read that small warning label that says not to be used longer than 3 days. And the reason why they put that is because you can actually get what's called rebound congestion. So again, let me explain what this means. You have nasal congestion, you can't breathe, you have a cold, maybe you have the flu, and you start using Afrin the first day. You can breathe like no other, and you feel good all day long. And then the second day comes, you use your Afrin. It helps, but maybe it starts to wear off, within 6 to 8 hours, so you gotta use it again. On day 3, you're noticing that you're having to use the Afrin almost every 2 to 4 hours for you to breathe, and the congestion is worse than what it was on day 1. That's called rebound congestion, and getting off Afrin is very difficult because you almost have to retrain yourself. Same idea with Ambien. I have patients who come in here who've been on Ambien for years. The first night of taking Ambien, you're gonna have the best sleep that you've ever had in your entire life. So then the second night comes and you go, oh, I just really wanna have that good night's sleep again. So you'll take that Ambien. But what you'll realize is maybe you wake up a little bit earlier than you did the night before. So then the third night comes and you notice that you wake up maybe at midnight this time. So you look at your Ambien and you go, I can take maybe a half, and that half will put me back down. Before you know it, you're in this pattern or this routine where you're almost taking 2 or 3 Ambiens just to keep you asleep. And what's happening is you're no longer getting REM sleep. The same thing happens with Trimix. Once you lose that brain-penis connection, you have to learn how to get that back. And it's this rebound erection addiction is what I like to call it. So for me, I'm not a fan of prescribing Trimix. I'm not. So if you're looking to get off your Trimix injections, you can't do it cold turkey, just like you couldn't quit Ambien or Afrin cold turkey. It's a process. It's gonna take some time and some commitment on your part. So this is something I always have to explain to my patients when I see them here at the office. So what we want to do here at Novus is we want to actually get to the root cause of why you're having erectile dysfunction rather than giving you this temporary Band-Aid relief. Let's start being proactive about our health rather than reactive. That's why I don't prescribe Trimix here at my office.
The P-shot, or the priapus shot, is a unique type of medical procedure developed by Dr. Charles Reynolds in 2012. Now, PRP has already been shown to be very effective with joint pain, hair regrowth, skin rejuvenation. So Dr. Reynolds questioned, well, if it does all that for these other parts of the body, what happens if I try to use it for the penis, erectile dysfunction, Peyronie's disease, enhancing the quality and health and size of the penis? So he tried it on himself, and voila, results. He then did trials on other people, and through those trials concluded that platelet-rich plasma injected into the penis is wonderful at helping erectile dysfunction, Peyronie's disease, and for healthy men who don't have problems, enhancing that tissue, oftentimes increasing the size, the girth and length, as well as just creating stronger, harder erections. So how is the P-shot administered in our office? Let me walk you through a typical day. When you get here, one of the first things we have you do is apply a topical numbing cream to the penis and the surrounding tissue. And then while that's taking time to get you numb down there, we do a consultation, make sure all of your questions get answered, talk about post-care, and about 20-30 minutes later, you're ready to go. That's where we turn you over to the provider, who one of the first things that she's gonna do is pull your blood, and then that starts spinning in the centrifuge to isolate your platelet-rich plasma. And then we also do a nerve block. Now, you're already numb from the numbing cream, so you don't even feel the little tiny pinprick from the nerve block, but what that's doing, just like when you go to the dentist and it numbs that whole area, it's gonna desensitize the entire shaft of the penis, so that by the time it gets to the point where we're talking about needles, which no guy likes to hear, you're numb down there. You're not gonna feel much of anything. In fact, I always ask guys afterwards, all right, how was it really? You know, a lot of guys are, nervous, rightfully so. 1 to 10, 10 being painful, most guys say it's maybe a 2, if that. So after the nerve block starts to take place and starts to take effect, we have you do one of our Nova Wave treatments. It's about a 20-25 minute procedure that's using shockwave or low intensity shockwave to break up plaque in the blood vessels, stimulate that new blood vessel growth, that angiogenesis, and also prepare the tissue to ideally receive the PRP and maximize it. And then the PRP is pulled up into needles, and that is injected into several different places throughout the shaft. And that's the P-shot. Now, we asked you guys just to take it easy and do nothing for 24 hours. And then from there, we have you start using a pump, which is what's been explained during the consultation. Real easy procedure, we make it very comfortable, and a lot of guys will say, what side effects might there be? Every now and then, some guys will have some light bruising, but that's about it. I mean, what side effects are you gonna have when you're using your own blood? I mean, think about it, and that's it.
So now that we've discussed the difference between the Trimix injection and the PRP P-shot, which one is right for you? And which one do you need for whatever desired result you're looking for? We see a lot of male entertainers, men who work in the porn industry. And if you think about their job is to have an erection, and they have to have an erection for about 4 hours because that's how long their sets are. So for them, they have to inject Trimix. They just do in order for them to get their set done. So I have men who come in to see us who inject Trimix about 3 times a week. Again, because it's their job. They have to be fully erect and they have to be ready to go for about 4 hours. But remember what I said before, when you're injecting a synthetic medication into this healthy tissue, you can create scar tissue. And so, these guys will come in and they've got some dense buildup and some scar tissue that's already forming. And so for them, they're gonna come in to get the PRP shot to help regenerate that tissue. So again, Trimix is used for sexual encounter, meaning I need to have an erection and I need to have it within 5 to 10 minutes and I need it to last for 4 hours. The PRP shot is meant to regenerate. It's regenerating tissue. It's creating new healthy tissue in your penis. So if you think about it, again, going back to being proactive versus reactive in your healthcare, if you're suffering from erectile dysfunction, let's stop using a Band-Aid. Band-Aid meaning Trimix injections or PDE5 inhibitors. Why don't you start creating or repairing that damaged tissue? Get to the root cause of the problem that's causing this erectile dysfunction. And that's where the PRP shot comes into play.
So hopefully that answered your questions and you now know the difference between the Trimix and the PRP shot. Not all injections are created equal. Each one serves a purpose. Make sure if you have any other questions that maybe didn't get answered during this, please leave them in the comments below. If you'd like to learn more about the P-shot, check out the website or give the office a call.
All studies used in the research of this video can be found in the link below. Hope to see you soon.